I'm Carla Whorton, nurse practitioner and anti-aging health provider certified via A4M. In this video, I'm going to discuss premenopause. Yes, we're all premenopausal right until we're not. These women have been ignored for way too long and need to be aware of what is going on in their body. I was ignored. I had breast cancer at 29. I take care of women in premenopause, perimenopause, post-menopause, and yes, even puberty. Symptoms of progesterone deficiency: weight gain and lipedema, PMS, PMDD, fibroids, PCOS, endometriosis, tender lumpy breast, infertility, even autoimmune diseases. The premenopausal woman is not the perimenopausal. Premenopause is 20s, mid-20s to 40 or so until perimenopause picks up. This is the young bride, the young mother, the young woman who is taking care of everyone else but herself, that never even thinks about the word premenopause. She is shuffling her kids back and forth to school. She's going to work. She's a woman trying to get pregnant. She's juggling home life and work life and trying her best to give love and attention to her kids. She forgets to take care of herself. The word menopause never enters the mind. She still cycles regularly. However, only by the time a woman is 35, she only has 35% of the progesterone she used to have. She might never have the clue that something is amiss until severe symptoms of imbalance appear that indicate PCOS, endometriosis, or infertility, or yes, even breast cancer. Progesterone begins to decrease in the younger woman in the mid-20s. At the time she's 35, she only has 50%. Also, by the time she's 40, her testosterone is almost depleted. Both of these protect us from breast cancer when balanced. We need our progesterone. We need our estrogen, our testosterone, but they need to be balanced, and the metabolites need to be balanced. We have to use them and lose them. Our hormones are messengers. They go to other areas of the body and sit on the receptor sites to tell that part of the body what to do. Imagine the receptor site as a chair. The progesterone has to sit in the chair to do its job. Synthetic progestin does not sit in the chair, does not fit in the chair. It hangs around for way too long and causes a buildup of bad metabolites. But what does it do for us? Progesterone is the additive of nature. It's the hormone. It potentiates the GABA receptor in our brain, which has a calming anti-anxiety effect and also promotes the formation of myelin sheaths. Progesterone has a positive effect on sleep. It helps prevent irritability, mood swings, and depression. It is a natural diuretic. Progesterone aids in ovulation, plays a role in the formation of embryos, pregnancy, and the maintenance of that pregnancy. It is a sticky hormone to help the embryo implant and stay attached to the inside lining of the uterus. It is made in the ovaries until natural or surgical menopause, and then in the adrenal glands, but yes, it starts going down early. It is an anti-inflammatory. It balances estrogen, potentiates the effect of thyroid hormones. Progesterone balances estrogen and protects breast health and supports the immune system. Progesterone upregulates occlutin in the gut to hold the one-cell thick gut lining intact. In cases of inflammation, these cells can pull apart. Yes, the gut is only one epithelial cell thick, held together by tight junctions and occlutin. This prevents increased permeability or leaky gut. This can lead to autoimmune diseases. Estrogen helps maintain our estrobolome to maintain homeostasis and a healthy gut. Progesterone also relaxes the smooth muscle of the gut to facilitate digestion in food. Progesterone helps build bone and it maintains bladder function. Work in Smith, 2010. Progesterone also relaxes the arteries in the heart, leading to vasodilation. Minshaw et al. In 2001 actually injected serotonin into the coronary arteries of rhesus monkeys to force them to vasoconstrict. I know that's terrible. Then they injected progesterone, which vasodilated the arteries, and the monkey lived, proving the efficacy of progesterone in downregulating thromboxane A2 receptors. Minshaw, 2001. Thromboxane A2, by the way, is one of the bad eicosanoids released at the domino line after insulin is released that causes diseases. This explains that physiology. Thromboxane A2 stimulates new platelets as well as potentiates platelet aggregation. To understand this and make it real, aspirin irreversibly inhibits platelet COX-1, preventing the formation of prostaglandin H2 and therefore thromboxane A2. This is why doctors prescribe aspirin every day to prevent clotting with their heart patients. Aspirin inhibits good eicosanoids too, so that's what we might not want to do. Let's just do it with progesterone. Estradiol and progesterone regulate proliferation and apoptosis in colon cancer. That is Sasso CV et al. 2019. We conclude that the action of both hormones, estradiol and progesterone, is necessary to reduce proliferation and increase apoptosis in colon tumors, probably through estrogen receptor beta activation. We need a balance. We do not want progesterone excess either, but the only way to do that is if you basically overdose on it. The symptoms of pre-menopause might be due to low progesterone or not enough to go to the hormonal chair to do its job. It might be due to not being able to get in the receptor site, the chair, with too much insulin or toxins. It might be that toxins such as insecticides, phytoestrogens, or endocrine disruptors, synthetic hormones such as progestin, are blocking or sitting in that chair. Progestin sit in the chair but do not perform all the functions of real progesterone, but they decrease the formation of our own natural progesterone due to activation and the HPO axis. It might be due to stress. With a rising cortisol, progesterone goes down because of the precursors are making cortisol. It could be due to poor diet and eating disorders such as anorexia and bulimia and low body fat percentage. This causes anovulation. If you're not ovulating, you are not having a period and you're not forming progesterone. Low progesterone could be related to excessive sugar intake, processed foods, saturated fat, deficiency of some vitamins, and low progesterone can be due to thyroid issues too. Low progesterone might be due to birth control, which is synthetic progestin. It might be due to other medications that block LH and FSH from the pituitary gland that are actually intended to block hormone production. These medications block all hormones, which is very dangerous. It might help the immediate problems, but in the long run, the diseases of anti-aging and aging itself will be expedited. Even NSAIDs and opioid painkillers can block our production of progesterone. Low progesterone might be due to the exaggerated effects of too much estrogen, or most likely the metabolites of those estrogens, one of which is proliferation and causes fibrosis in other issues. Progesterone declines earlier if there's increased stress. High cortisol decreases the progesterone. Lower progesterone leads to estrogen dominance, which is one of the main causes of weight gain. And lipedema, estrogen dominance, causes proliferation. With all of this progesterone down by half by the age of 35, it's no wonder. All of this leads to estrogen dominance. Symptoms occur because of the low progesterone, losing the marvelous effects it has on our body. And second, due to higher estrogen, an exaggeration of the effects of estrogen. And third, the symptoms that occur due to this imbalance can cause depression, anxiety, irritability, mood swings, migraines, insomnia, infertility. These are the symptoms that we know and feel. But what about the ones we do not feel? The risk of breast and uterine cancer rises, osteoporosis, increased LDL, just to name a few. Estrogen must have opposing progesterone. At this time of low progesterone and high estrogens, we have to consider the metabolites of these hormones. The Dutch test gets all three estrogens, all of the metabolites, and they can recycle in the body and sit on the receptor sites, causing endometriosis, fibroids, in the increased risk of breast cancer, endometrial and uterine cancer, and others. The Dutch test looks at the metabolites also of testosterone and the androgens to detect PCOS. As far as hormones go, we have to use them and lose them. Estrogen is not the enemy. We need our estrogens, but we have to balance our estrogens. We have to balance the metabolites. We have to be able to clear them. Estradiol, E2, is cardioprotective and neuroprotective. Estradiol actually prevents breast cancer by sitting on the receptor site of the one that estrone, E1, the stronger one, likes to occupy. The metabolites of estrogen can cause these issues faster than the estrogens themselves because they have a stronger affinity for the receptor sites. We have three phases of detoxification. The phase 3 is actually the gut. Constipation can actually cause high metabolites. Breast cancer is the byproduct of the perfect storm. My perfect storm, and with the lipedema and all of these issues with my daughter and I, it was the perfect storm for all of these issues. If this is true, the doctor said that these issues had to have started growing, the breast cancer, at 21. If it was that big enough for me to find it at 29. If that's true, it had to have started affecting the tissues at puberty. Same thing with Brandy. If her endometriosis was so bad at 21, it had to be excised. It had to have started affecting her at the cellular level right at or right after puberty. It's obvious how anti-aging, epigenetics, hormone testing, and balance, the metabolite testing, and including the thyroid, has affected our life. Let's juggle your chemicals in your body. We can do it. We can hack the hormones. To your health, hormones, lipedema, and weight optimization with me, Carla Whorton, NP, in Scottsdale, Arizona. Thank you so much for your time.